Good afternoon to my fellow Mississippians, members of the press. Thank you for being here. I want to begin today, this Friday afternoon, by reminding everyone that this fight is not over. Please take me seriously. Please take this virus seriously. I know both of these gentlemen at this table, and everyone in this state want this to be over. It is not. You are needed. It is by your action that can make a difference. You can keep yourself, your family, and your neighbors safe. This virus is real. This virus is a threat. It is deadly. And please, I beg you, do not listen to the voices in your life that tell you that there is no danger. There is danger for all of us. There is particular danger for those over the age of 65 and those who have pre-existing conditions. I hope we have been successful at communicating that to you. We've been here every single day at 2:30, sounding the alarm. That will not end today. This fight is not over. We are not back to normal because our enemy is still in our midst. There is, however, another disaster unfolding. This week, we reached the highest unemployment rate in the United States of America since the Great Depression. Let me say that again. In our country, we reached the highest unemployment rate since the Great Depression. In our state, 200,000 of our fellow Mississippians have filed for unemployment insurance in just the last 7 weeks. Here is where I stand today. The human cost of another Great Depression is higher than a benefit of broad orders. As we work to reopen our economy, that is not a signal that the threat of the virus is gone. Do not mistake my efforts to protect people from the Great Depression threat for a belief that the public health threat is not real. Our strategy of identifying and isolating those who have the virus will continue. Our strategy of testing will continue. Our strategy of making it illegal for many small businesses to operate is not sustainable. We are going to stay vigilant. In fact, there are some limited portions of our state where we probably will need to get even more strict. We are working on that plan now. There are some people who want us to do surgery with a sledgehammer, shut everything down for months and months and months on end, and ignore the consequences until there is no more risk. We have said from the beginning, shutdowns for weeks and weeks and months on end are not sustainable. They're not sustainable in Mississippi, they're not sustainable in this country, and they're not sustainable around the world. The fact of the matter is, we cannot shut everything down until there is no more risk. We have to live in the real world. To that end, I signed earlier today a new executive order. Our Safer at Home order, which was set to expire on Monday, will be extended for 2 weeks. There will still be rules in place. No indoor gatherings with groups of more than 10. No outdoor gatherings with groups of more than 20. We are still urging people to stay home as often as possible. And we are still telling those in that most vulnerable category, those over the age of 65, and those with pre-existing conditions, to stay home. We are placing strict health rules on salons and barbers and allowing them to reopen. Same thing with gyms. Now let's all be honest. We are not doing this because there is no risk associated with you going there. There is risk every single time you leave your home. There will be risk should you choose to go to any of these businesses that will be reopened. I'm doing this because I believe that I cannot allow our small businesses to fold and for families to be destroyed simply by government order. You have to make wise decisions for yourself and your family. You have to do what we have begged from the beginning. Stay smart. Use common sense. Stay safe. Look out for your friends and your family and your neighbors. Show the true spirit of Mississippi. We can do this. We can reopen, and we can be smart. Let's work together to prove to the rest of the world that we can protect and provide for those 200,000 Mississippians who have lost their jobs in the last 7 weeks, while still protecting and providing for those most vulnerable amongst us. I believe in my heart that endless government shutdowns are not an option. Not when we are on the brink of an economic catastrophe, the likes of which we have not seen in over 100 years in our country. Now, Wall Street is going to be okay. My concern is about Main Street. Main Street, New Albany. Main Street, Amory. Main Street, Pass Christian. That's what I'm worried about. Small business owners and their employees whom they love being able to provide for their kids and their grandkids. I know that my only authority comes from the consent of the people. I asked all of you to allow me to enter these extraordinary measures to prevent the collapse of our healthcare system. I believe with whatever certainty I can muster in these ever-changing times that our healthcare system is as prepared as it could ever be. I do not believe that any Mississippian who could get better with quality care is in a position in which they will not receive that quality care. I do not believe that our healthcare system is going to get overwhelmed. I know that we must continue to monitor every single day. I know that these actions that I have taken to reopen certain industries will draw harsh criticism. I'm not worried about that. I cannot ask Mississippians to burn down their life's work and put their family at risk of starvation because I'm afraid of some national media or because I'm afraid of my reputation. We're reaching the point where the damage to these families is as disastrous as any virus. We are headed towards a point where the cure could become even worse than the disease. I have to do what I believe is right. But to the people of Mississippi, I am asking you, I am begging you to exercise personal responsibility. Do not put yourself or others at risk. Please listen. This virus is real. This virus is still in our communities. It is certainly worse in some communities than it is in others. That is an issue that we're continuing to monitor and talk about, and we'll probably make additional actions for certain areas as we go forward. I want you to know, to those of you who are as worried as I am about the public health dangers, I truly believe that this stand today can help us accomplish both of our goals. If you back people into a corner, they will give up on the mission rather than ease up on the measures. Pushing for shutdowns with no end in sight, in my opinion, at this point, will do more harm in our fight against the virus than good. I truly believe that. These are unprecedented times, and I will admit, I do not have all of the answers. I do have a very strong team around me. They are working overtime and have been 24 hours a day, 7 days a week, week after week after week. I know that the people of our state are hurting badly. I've seen you. I've heard you. I've gotten your text. You're hurting from this virus. You're also hurting from the economic damage it has caused. I hope that over this weekend and into next week, everyone is looking out for their neighbors and taking care of them. I know the hearts of Mississippians, and because I know your heart, I believe you are doing your best in these difficult times. I know that we will get through this together. Thank you for your efforts over these many weeks. Please remain diligent in the days and weeks ahead. Together, we're going to prove to this country that Mississippians in times of need step up, take care of themselves, and take care of their neighbors. At this time, I'd like to ask Dr. Dobbs to give us an update from a public health perspective.
Excellent. Thank you, Governor. Quick update for today. We're reporting 404 new cases today and sadly 13 deaths. 3 of those deaths were identified from previous death certificates. If we look at our total number of cases, we stand at 9,090 with a total of 409 deaths. One of the things that's very interesting to note about this is our hospitalization rate also has dropped over time. If we look at the reasons for our ongoing case increases, there's multiple things driving this. Certainly one of the issues is ongoing community transmission, and that's extremely important for us to maintain our social distancing and our masks and other protective measures so that we can prevent additional transmission. But certainly, as we've discussed, we do have specific communities outbreaks, and certain localities and certain counties are seeing a lot more difficulty than others, and certainly we're going to work more aggressively with those areas. Certainly we've had long-term care outbreaks, which are very challenging, not only in the sense of the number of people involved, but also the vulnerability, and we're working those very, very aggressively. But another thing that's very important, and for this reason I think we're not going to see major declines in numbers, hopefully we'll see a little bit flattening, is testing. We're testing so many more people than we were. We're well above our target thresholds on a day-to-day testing to meet the 2% per month or testing goal for the state. So that's a big part of this. And if you look at other states, especially I think North Carolina is a good comparison because they're in many ways in a similar situation. They're having steady, gradual increases that doesn't reflect so much worsening case burden as much as more testing and finding people are not quite as symptomatic as reflected by this lower hospitalization rate. But that doesn't take away from the other causes, which are ongoing community transmission and sort of like areas of excess case load and also outbreaks. So we have to approach all of these aggressively, but they have different strategies. If we look at our hospitalizations, so far we've seen stability and declines today have been noted. We are down to 435 hospitalized patients with coronavirus. ICU utilization is at 123, and ventilator use is down to 58 patients. That's all I have, Governor. Thank you.
Thank you, Dr. Dobbs, for your leadership during these times. Director Michelle is on site visits, meeting with local emergency management directors, because while we are running our state EOC, dealing with this public health crisis, we also have many tornadoes that we are dealing with as well. And so today his chief deputy is here. And Mac, I'm going to turn it over to you.
Yes, sir. Thank you, Governor. Mac McCraney, on behalf of the Executive Director, wanted to talk about a few things and give you an update on where we are on the past storms as well as our current COVID response. Today, along with the National Guard and the Department of Health and those logistics folks there, we delivered over 42 Tier 1 facilities, and that is anything from a face mask to gowns to gloves to those PPE items that they need so dearly. We monitor that daily, along with the Department of Health, getting those numbers, and we're making sure that we get logistics to them just in time, sir, to make sure that we're taking care of the patients and we're taking care of those caregivers' needs. On a personal note, my wife walked into UMMC today as a nurse, and she observed the National Guard and others clapping and appreciating her. And I can tell you she keeps a tight rein on the rest of the family on our PPE there, Dr. Dobbs, and what we need to be doing. So getting a look over the shoulder, so to speak. Drive-through locations, along with the Department of Health, we're setting up over the next 4 days. It's going to be in Jasper County, starting this Saturday, Benton and Jasper counties. Monday will be Montgomery and Newton counties, and Tuesday will be Jones and Winston counties. So we continue to caress the state and set up those drive-through locations to be able to get to test all those individuals that need to be able to have that done. We've got 3 storms that we've been working. The January 10th storm, we have about 32 applicants there. 13 counties have applied for assistance, and we continue to process those. April 12th storm, the Easter storm, as I like to call it. We've got 7 counties, 3 original counties, 7 have been requested for individual assistance, as well as 25 counties for public assistance. And those applicants continue to mount there. We're waiting on a response from FEMA headquarters on that. The February 10th storm, the Pearl River flooding that most of us have forgotten about, that affected the city of Jackson, the reservoir, and other areas. We have 11 counties that have been approved. We're also looking to add Wilkinson, Marion counties. We have 2 others, Issaquah and Sharkey, but they are affected by the backwater flooding right now. Continue to be underwater so we can get damage assessments. So we have 4 additional counties we're going to try to add to that storm. And about 30 minutes before I reported in for this meeting, I advised the governor that the April 22nd and 23rd storms, today we reached the state's threshold, which is over $4.5 million. We have 8 counties currently assigned there, as that's Emmett, Claiborne, Covington, George, Jefferson Davis, Lawrence, Pike, and Simpson counties. And we are currently have a request in for FEMA, and we'll start joint assessments on those counties tomorrow, sir. We've announced to the group that this is Hurricane Preparedness Week. We've started off from determining your risk to developing an evacuation plan, your disaster supplies, do you have that together, your insurance checkups. Yesterday was strengthening your home, and today we find ourselves in helping your neighbor. You have a neighbor, an elderly neighbor, or someone who is in need of assistance. Please help your neighbors prepare. Help them evacuate and check on them when they return back from the storm. as I will probably not be able to brief the press tomorrow, it's completing your written plan. And this is the most important part, is documenting every bit of your important and valuable items that you have. Take a photo of them, and also keep your important papers in one location where you can take them with you. And if you can scan and make a digital copy, that is very important. When FEMA and MEMA and insurance agencies, we come to town, we need to see those documents to be able to get your funds flowing just as quick as we can. I will announce that tomorrow morning, about 10 o'clock, we're meeting with all 82 emergency management directors, as well as the Mississippi Band of Choctaw Indians, and we are going over the hurricane plan for the state of Mississippi. COVID-19 gives us some special things to be thinking about as we used to run normal shelter operations. We're going to have to look at social distancing and things of that nature, as well as we've already started planning. But we want to hear from the counties. We want to hear from those local jurisdictions on what their concerns are and what we can do to help them meet those concerns and to mitigate them. So that's all I have, sir.
Thank you, Mac. I've known Mac for a long time. I think what you can see today is that behind Director Michelle, as well as behind Dr. Dobbs, we have exceptionally talented people in these executive agencies, and I couldn't be more proud of them. I believe it was yesterday or the day before that I did a video for our nurses, because this is, I believe, National Nurses Week. Tell your wife a special thank you. She is a hero, and she represents so many Mississippi heroes that are on the front lines every single day treating patients in our hospitals. And I want you to know that Ely and I pray for you every day, and we thank you every single day. With that, I'll open it to questions. Courtney Ann.
A week ago today, 397 cases and 20 deaths. That day, you said you stepped back. You had planned to announce more reopenings. Today, we're seeing higher number of cases, even though just by a few, and close to the same number in deaths. Tell us about that decision-making that went into that, and knowing that the cases are still high and still saying that you would reopen more.
Right. The fact is that we did have 390 cases last Friday. That was followed by 2 days in which we had 220 cases and then 110 cases. And so while I think we must continue to monitor the total number of cases that are reported each day, what we tend to find is that there are certain days when we have data dumps, for instance. There are certain days when testing centers send out results. And so all of these positive tests are not a result of sort of the testing mechanism that's going on at the State Department of Health, where they're basically getting tests back every 24 hours. And so if we knew that every one of these tests came in just in a certain period of time, we may have a different viewpoint on it. But we do still have the virus in communities throughout Mississippi, and we have to understand that. The other point I would make is that we're doing even more testing now. And so as you do more and more testing, you should expect to find more and more positive cases. Because if you look at study after study, none of which, by the way, are properly peer-reviewed at this time, but there are 3 different studies that have been discussed a lot, one in California, one in New York, and then another one, I think, in Italy, but there's a third one. And what they are finding is that for every 5 positive tested cases, there could be as many as 50 to 80 cases. Well, for every one, there could be as many as 50 to 80. So there could be as much as 95% of the people who have actually had the virus never tested positive for it because they were asymptomatic. And so what we've got to do is we've got to focus going forward on those communities where the virus is more prevalent, where we're getting more and more positive cases, where community spread is occurring. You've heard me say this as of a couple of days ago. In Scott County, there was over 100 new cases in the last 14 days, whereas in Alcorn County, there was 1 new case over 14 days. Given where we find ourselves economically, we can no longer treat Scott County and Alcorn County the same. We cannot take a sledgehammer to this surgical process. We need to be surgical in our responses. And Dr. Dobbs has been talking over the last several days about the 10 to 12 counties where they have the most cases, and then, of course, the 5 or 6 counties that have really large number of cases on a per capita basis, we've got to recognize that, and we've got to go in and we've got to push resources there. The other thing I'll tell you that you heard today is that while we did have 400 new cases today, and that's very, very troubling, our total number of hospitalizations, our total number of patients in ICU, and our total number of patients on ventilators has declined. We've either been flat or more or less a slight uptick, but it started to decline. That's a positive sign. Should that mean that we shouldn't look at it anymore? No. We have to continue to monitor it. But the hospitalizations are critical. We have always said that our goal is not to stop the spread of the virus, because if that were our goal, we would be unsuccessful, because there's no way to stop the spread of the virus that is realistic and that can be maintained long term. You cannot take every single human being in Mississippi, lock them in their homes, and tell them you can't leave for 6 months. If we did that, it may stop the virus, but that's not a realistic approach. Someone's got to eat, and someone has to provide food for others. And so as we look at where we find ourselves today, we believe that this measured approach is the right thing to do. There were those who believed that we should have issued a shelter-in-place order much earlier. I believe we issued the shelter-in-place order at the right time. There are those who have believed we should have kept it in place much longer. I believe we've started the process of reopening at the right time. Now, there are those who think we should have never had a shelter-in-place order, and I get that. It has pained me greatly to issue these orders. It's power that I never wanted and wished I never had to use. But I do believe that we have been successful at slowing the spread of the virus such that we have flattened the curve rather than having a major peak like occurred in New York or New Jersey or Louisiana, which led to many, many, many more deaths per capita than where we find ourselves today. We've got to remain diligent. We've got to continue to have a strategy, and we've got to continue to execute that strategy, and I'm committed to do that.
Quick follow-up.
Sure.
Why not limit, or why not keep the restrictions in place for these hotspot areas? I know you said that there's still discussions being had, but since we know that those are hotspots, why allow for barbershops, salons, and gyms to open in those areas where we know there's significant community transmission?
Well, remember, the current Safer at Home order is in effect until 8 a.m. on Monday. And I would just say stay tuned. Yes, sir.
Correct me if I'm wrong, but it seems that as if you're conceding that there will be more cases, which will inevitably be, in some cases, deaths. Why cherry pick which industry should open? Why not let the economy of Mississippi open now, considering, the virus is still out there, there's still community transmission, people are still going to get sick, yet people can go to work tomorrow if at a swipe of a pen. Why not open the economy?
Well, I think, Gerald, what you will see is when we get to Monday morning at 8 a.m., 95+% roughly of our industries in Mississippi will be open. But we also have to be smart enough to know that there are some industries that have more high-risk categories and a higher risk of transmission than others. The barbershops and the salons that we are opening next week, in our opinion, had a higher risk of transmission than, say, eating at a restaurant outdoors. And so the measured approach that we have instituted from the beginning is to be taking into account the data, also take into account the risk associated with the various industries, the risk associated with the various businesses that are open, the fact that certain industries, such as grocery stores, had to remain open so as to allow for individuals to feed themselves. And as we continue down this path, we're going to continue to give people the opportunity to get back to a more normal. It's not going to be normal. We have guidelines in place for barbershops. We're going to have guidelines in place for salons, which is going to minimize the risk, not going to eliminate the risk. I want to be clear If you are in the vulnerable category, if you are over the age of 65, if you have pre-existing conditions, getting out of your home has risk. Going to a salon has risk. But we're trying to put measures in place to minimize those risks. We recognize also that the spread of the virus has risk. The spread of the economic collapse has risk. The fact that we are seeing more and more mental health issues coming out of this has risk. There are no decisions to be made at this point in time, and I would argue there's been none over the last 6 weeks, in which we thought, on one hand, we could make this decision and eliminate all risk. On this hand, we can make a decision and we have 100% risk. That's not the way these things work. So what we're trying to do is, over time, be measured, be data-driven, be smart, and ultimately get our people back to work and our economy moving while still taking into account the public health risk.
Allie Martin, WCBI, has a question. Allie?
Yes, thank you, Governor. I talked to a gym owner today who's also a close friend of mine, and he, as you know, has been hurt the last 8 weeks because of all this. Will there be some relief? Even though they're able to open Monday, will there be some relief available for them for these 8 weeks of some of their members have dropped? They haven't been able to add new members. His comment, I think, was, they signed up to flatten the curve, which you mentioned has happened, but they didn't sign up for the next Great Depression. So what advice or what, I guess, what would you want to tell those folks? And also churches, any word on the churches maybe being able to open back up?
Well, thank you, Allie. Appreciate the question. We live in a great society when we can do a statewide press conference and I can get a question from Allie in his vehicle, which is where he is, it appears. For gym owners, we are allowing them to reopen on Monday. I want to be clear, we are allowing them to reopen with a large amount of guidelines that they must follow. This is for not only the business owners, but also for those individuals that want to get back in their local gym. We are hopeful, and we are working towards having a deal in which we can get resources to small business owners that have been affected because of their government has shut them down. I am 100% supportive of doing that, and I'm hopeful that we can get that done quickly. The legislative leaders have assured me that they can, and I am very hopeful that works out and that we get that money to the people very, very, very soon. Renee?
Dave Elliott, WOX, has a question. Dave?
Thank you, Renee. Two questions, one very quick clarification, and then a question. With hair salons, barbershops, and gyms allowed to open on Monday, and you talk about these strict guidelines, when are these guidelines going to be made available to the owners of these businesses? Where can they go to see what the new rules are? And now I have a second question. Congress is looking at CARES Act 2, the new package, about $750 billion. It appears as if, particularly in the House, they're concentrating on aid for larger states and big cities, mostly with a population of 500,000 or more. None of that applies to Mississippi. Are you concerned about that, or are senators and representatives ready to fight for the state?
Yeah, thanks for the question, Dave. The guidelines for barbershops, for salons, and for gyms will be available certainly on the Secretary of State's website. The Secretary of State actually witnesses the governor's signature, and I'm sure that we will have copies available as well to give to the media so that you can get it out also. And I'm sure we'll push it out through our social media sites as well. With respect to the additional resources being sent from the federal government, it does not surprise me at all that the House of Representatives that is run by a liberal Democrat from California would focus on big states and on cities with populations of more than 500,000. But the fact of the matter is, I feel confident that our leadership in Mississippi and our leadership in the Senate will certainly make sure that all states are treated fairly and equally. This virus has not known very much about state lines or county lines or city lines, or it hasn't seemed to care really if you're a Republican or a Democrat or anything along those lines, and I don't think that the relief efforts ought to care about that either. Politics at a time like this is just wrong, and there's no reason for us to pit big states versus small states, big cities versus small cities, and I'm hopeful that the Congress recognizes that, and I feel very confident that certainly the President will stand up for us as well. Renee.
Caleb with Daily Journal has a question. Caleb?
Governor, quick question about the plan the legislature is working through related to relief for small businesses. Now, the legislation has not been finalized yet, but as that legislation currently exists, the Mississippi Development Authority would administer the relief process. Now, I know in a committee hearing there were some questions today about whether MDE could effectively and efficiently manage that process. There were concerns raised about the backlogs we've seen related to unemployment benefits. Do you think MDA is the appropriate entity to manage relief funds for small businesses?
Well, I would tell you that we're early in the process. We are certainly having conversations with the leaders in the legislature. We're going to monitor that. We're going to review the legislation. We're going to fight to make sure that the right entity is overseeing each and every program. And so I can't speak specifically to that legislation because I haven't read it yet. But I will tell you that our parameters are that the right agency must oversee it. They must be properly staffed. We believe there are certain ways and manners of pre-auditing those funds that are critical. And so there's a number of critical steps that must be taken. But we are early in the process, and we are working with the legislative leaders to make that happen. Thank you. Courtney Ann.
I'm getting lots of questions. For quick clarification's sake, the gyms, salons, barbershops, they would be able to open Monday morning at 8 because that's when this current one expires. Is that right? Just
That's
for folks
correct.
at home.
That's correct. That is correct. Monday morning at 8 a.m. But there's a lot of things that they probably need to do between now and then. That's why we wanted to announce it early. We've got to get cleaning done and things such as that in the facilities, and so but certainly that is definitely a possibility.
Nick June from Jackson Free Press has a question. Nick?
Yes, question for Dr. Dobbs and then a quick follow-up for Governor Reeves. Dr. Dobbs, what is the mechanism that will cause cases to decline? With 400 new cases a day, with community transmission, and now with essentially all industries back open, what mechanically is going to cause the infections next week or the week after that or the month after that to go down? Or are we kind of transitioning to a herd immunity strategy?
Probably a couple things that help us really see declines. I mean, one of them is going to be controlling outbreaks. If we didn't have the outbreaks or if we didn't have excess number of cases in certain locations, we'd be seeing a pretty remarkable decline. So that's why we're investing so much effort into these couple of areas. It's kind of, we're a little bit to go where the money is sort of situation. So we're going to really try to focus on those and depend upon the community and our other gradual, well thought out sort of approach to opening to kind of help the other areas get into a better place. The testing is going to continue to be robust, and that's going to keep our case numbers up until we really have a pretty good drop, and that's okay. It's important for us to look at the other metrics that tell us how we're doing, the hospitalization utilization, the percent hospitalization. We're working aggressively to get a percent positive for our tests. That can be a little bit misleading too because we're actually trying to test a lot higher a higher likelihood of people being infected by testing everybody in a nursing home. We're actually detecting a lot of asymptomatic cases that we otherwise would have missed. And then, and I think your last question was about the herd immunity strategy. No, not looking at a herd immunity strategy. Even though a lot of people have been infected that we don't know about and may have immunity, it's really not conceivable that there are enough people who are immune to get herd immunity. We really would need to be looking at probably 80 to 90% people who've been infected, and it's really not conceivable that we're going to be anywhere near that in the near future. So hopefully we'll have a vaccine to take care of the back end of that.
Cornelia?
Thank you.
Oh.
Now, for the governor, I see here the restrictions on gyms and salons, and they're pretty strict from what I can see. How will these restrictions be enforced, and what will the penalty be for breaking them?
Yeah, the guidelines are take into account the risk associated with these industries. I do believe that they can be met, and they can be met in a safe way. We're going to allow for the enforcement of this particular Safer at Home order extension in the same manner that we've enforced the previous ones. We have state law enforcement available, but the local jurisdictions, our counties and our cities, do a fantastic job and have done a fantastic job throughout this entire episode, and I trust that they will continue to be able to do a fantastic job monitoring the individual entities. And more importantly than that, while we have law enforcement that are capable of doing it, the number one person that is going to enforce this is the person that is actually opening the business. It's the employees. It's Mississippians. It's people who care about not only themselves, but about their fellow man. I am convinced that the industries that we are reopening are going to do a better job of monitoring themselves than any governmental entity ever will. I'm asking our barbershops, our salon owners, our gym owners to be smart, to be vigilant, to have hand sanitizer available, to do the things to ensure that you are protected and that your customers are protected. And I absolutely believe that they will do just that. Courtney Ann.
As has been the case with a lot of these announcements, getting questions about specifics, it only references salons and barbershops. What about nail salons, spas, things of that nature?
I think if you are a salon, you meet the guidance.
Anita Lee with Sun Herald has a question.
Great.
Anita?
Hello, thank you very much. This is for Dr. Dobbs. Dr. Dobbs, a reader has pointed out to me, I have to say I didn't notice that the testing numbers have not been on the website since Monday. Looking at the COVID tracking project, it's numbers from you and other sources. It looks like the numbers have actually dipped below the four figures into the hundreds. 631 on Tuesday, 217 on Wednesday, and 262 on Monday. What's going on with the reporting of numbers, and are the tests actually lower in the last few days than they have been?
No, so there's several things that are in the different things you mentioned. We have not yet updated our total negatives or our total tests for the state and for outside entities. Because we're trying to reformat that to catch more labs. More and more labs have opened up across the country as small businesses trying to capture and provide that service. And these are not businesses that have been reporting to us electronically. And so we're missing a lot of those. We know that. But even without those, we know we're still clocking, it looks like, at well over 2,000 and sometimes 3,000 a day from the information that we have. The other thing you mentioned was the state public health lab. And that's an entirely different thing. We've had a massive decline in the number of local hospitals who've had to test, because most of what we did before is people in the hospital. You can see hospital utilization has slowed down, and there's more use of private labs, and so that's to be expected. But we're starting to augment testing as we need to without breaks, because we can go in and test a nursing home and we can get 300 people in one day. And so that's where we're going to devote our capacity. So those are really separate considerations. But yeah, no, you're exactly right. We're working to get better numbers so that we can understand the situation better and make sure you guys have good information.
And I would just reiterate that the long-term care facilities is one area in which the Department of Health is spending a great deal of their time, effort, and resources. And I believe that that is the right strategy. If you look at both Italy and Spain, it appears that the data is coming back. Italy and Spain, as we know, are two of the 5 countries with the most cases and most deaths in the world. I've seen in both of those countries, they are now projecting that somewhere between 54 and 58% of the deaths in those 2 countries come out of long-term care facilities. So again, while there are certainly risks to those who are not in long-term care facilities, the risk is much higher for those who are. It's the reason we've taken such aggressive action to try to minimize the spread in those facilities. It's the reason that now, from a testing standpoint, they're going in and they're actually testing asymptomatic people, maybe testing everyone in the facility so that we can monitor, and if there's a positive test, that maybe even if someone hasn't started showing major symptoms, that we can be prepared for that and protect those individuals to the extent possible.
Dave from WLOX has another question. Dave?
Governor, President Trump said before the CARES Act was passed that he feared state employment office computer systems were, in his word, antiquated, offices bogged down with bureaucracy. According to the Washington Post, 40% of people trying to get benefits have been unable to complete the application because phone lines were busy, disconnected, website didn't work, so it's obviously a national problem. Mississippi legislative leaders have told me MDES must and will do a better job. What can they do that you haven't done?
Well, I will tell you that we have worked diligently throughout this process to ensure that we continue to increase the number of people at the Mississippi Department of Employment Security. We've gone from 50 employees to 350 employees, and those answering the phone. We actually, as you know, signed up a group of casino employees who are giving of their own time and their own effort to help in this battle. And so what I would tell you is that there are people at the Department of Employment Security who are working day and night, working literally 20 hours a day, 7 days a week, doing everything in their power to get the nearly 200,000 Mississippians that have applied successfully for unemployment benefits, the benefits they so desperately need. And I appreciate them. I appreciate their efforts. They are working around the clock. We have seen significant improvements over a very short period of time, and I appreciate their efforts.
Nick from Jackson Free Press has another question. Nick?
Governor, recently I asked you for guidance on MDES standards for unemployment moving forward. In this safer at home order, individuals over the age of 65 or with pre-existing conditions are, quote, encouraged to shelter at home. Does this mean they still qualify for unemployment if they are called back into work and decline the offer? And second, if an individual is the caretaker or housemate of a person who meets these categories, do they qualify for unemployment into this next period?
Again, unemployment eligibility is determined by the Department of Labor and by Mississippi statute. It's not determined by the governor. But what I would suggest to you is that if you meet the category and if you meet the category that is currently mandated to not leave your house, then I think there's certainly an argument to be made that you potentially would meet the qualifications for the order. In terms of other people who live with you, I'm not sure that is the I'm not sure that's a reason. But again, the unemployment insurance eligibility is determined by the Department of Labor and by the Mississippi Department of Employment Security. Looks like the last question. Thank you all. We're moving into the weekend. We have expected less than stellar weather today. Please be careful at home. And to all of my fellow Mississippians, thank you for working with us to get through this horrible pandemic. Thank you, and God bless.